This is an article from the Business Insider.
Bill Gates revealed a scary simulation that shows how a deadly flu could kill more than 30 million people within 6 months.
This was created by the Institute of Disease Modeling. I'll put the link in the description below. See, by month 5, it's starting to get a grip in the United States. I'll watch it again. This is a doctor talking about the medical procedures for handling the coronavirus and how he's going to tell you about the 143 patients, 57 of them that caught the virus. 41% of them didn't have it before they even got to the hospital. They developed it after they got into the hospital. It's very interesting.
41% of them developed the infection in the hospital. Of those 57, 17 of them were actual patients that were in the hospital for another reason. But a full 40 of these were healthcare workers. Let's go back to these 17 patients that were there. They said that 7 of them were on the surgical ward, and that 5 of them were on the internal medicine ward, and that 5 of them were on the oncology ward. Now, of these 40 patients that were actually healthcare workers there at the hospital, 31 of them, or 78%, were working on the wards. 7 of them, or 18%, were in the emergency room, and 2, or 5%, were working in the intensive care unit. They talked in the paper about one patient who presented with nausea and vomiting, which we said was kind of atypical, and he was admitted to the surgical ward. Well, he had coronavirus, and they believe, based on history and based on deductive reasoning, that about 10 people were infected because of his symptoms and his virus. And what was of his symptoms and his virus. So what this paper highlights, I think, is the transmissibility of this virus. And what we really need to highlight here is hand washing. And the key here is that you've got to wash for 20 seconds. And as we've said before, that's like singing happy birthday twice. Wash your hands with soap. And you need to do this before, of course, before you go into a patient's room, before you put on gloves, before you don a gown, and you need to do it after. And why is that? Because you're using your hands to take off your personal protective equipment that would have the virus on there. And really avoid touching your face with your hands. Now, what about masks? Well, if you are suspicious that the person that you are about to examine has the coronavirus, and you're a healthcare worker, they're recommending N95 masks. If you suspect that the patient is the one that has the virus, then they ought to be wearing a regular surgical mask. In addition to N95 masks, so this is for the patient and this is for you as a healthcare worker, you should also be doing eyewear protection. And you can see what the workers over in China are now currently wearing. They got the message, they understand what it is that's going on, and they're going to make sure that that doesn't happen again. And what this article, I think, really shows is the delicate balance that you have to strike when you have patients with a virus coming into a setting where there are other patients that don't have the virus. And I believe that is really the thrust as to why they are building these hospitals dedicated to the virus, so that they don't cross-infect other people, other healthcare workers, and that they can have the infrastructure in place to deal with the contamination that can occur in these places. Please stay tuned.
This is an apartment that's on fire in the quarantine zone of China, where the Wuhan virus, coronavirus, they've got the people locked up to prevent the spread of the disease, and that's the bars on the apartments across the street from these other apartments that are on fire. And it's showing a guy that's trying to escape and jumping out the window, and right here, see him, he falls from here to here while trying to escape the burning apartments. Video in China where guards are checking on people that are in the quarantine zone, checking to see if they have food. They're locked up for the quarantine of the coronavirus. See, the birds are flying around, and they said they're eating them, the dead people, like carrion. Sad. Can't get the video to play, sorry. There it is.
This is a crow clustering in Iro, Xining City, Qinghai Province. Crows love dead animals, like carrion.
This one shows the measures they have to go to prevent the spread of coronavirus by having tissues to push the button. And then she spits on it. Look, she spits on it to make everybody else sick. And sneezes on it, too. Look, coughs on it.
People also want to use gold to exchange with rice.
When people are desperate. The use of money? Under the #CCP, only power is useful.
See, with me, to hope that somebody will give them some food, I guess. With their apartment number on it, I guess.
Shocking news. China orders mass slaughter of all domestic pets. Euro Weekly News Spain. Dear China, this is why I will watch you all die with indifference. You are a vile people and I will release as much energy as I can to ensure your suffering.
See, here's a website where it shows them eating bats, you know, and it might just be that, you know, I can get this up. There it is. Oh, we can see it for a minute. That might be what's